Regardez ce qui va se
cameras. So in all the communal areas there is CCTV. We don't currently have CCTV in any of the bedrooms, although the bedrooms are wired because the Mental Health Commission quite rightly feel that patients should have that kind of dignity and respect. But obviously that's where, coming back to the question you asked, let's say for example we had concerns about risk, it might be at that point that somebody's on a one-to-one because you need to maintain their safety. So back to what Evie said, it's all about, it's, as I said, we've been saying all week, it's individual patient care, but it's a hospital-wide system, so it's quite different from being in the social care environment.
Cool. So, yeah, so thinking about the main points in the physical environment from a relational point of view, we want to create those opportunities for social engagement. If we're not on the ward, we're not going to be able to create those opportunities. It's, you know, it's their hope.
Correct me if I'm wrong, so, you know, depending on what discipline or what area in, you'll check in, come into work at a particular time. We will then have handovers. There will be a nursing handover, for example, so the nurses who are working all night and the healthcare assistants will need to hand over to the nurses coming on during the day. There will be a further handover a little bit later on in the morning, so the rest of us who were not on overnight and maybe not there first thing in the morning get a handover to know what's going on with all the patients. And then every day of the week there will be some things that are specific. So once a week, for example, especially when we're at full capacity, Dr. Evie will have a ward round 1 day a week with her patients. I will have a ward round 1 day a week with my patients. There will be other activities that are led by, for example, Dr. Capri or Anya. There will be activities that will be led by the nurses and the healthcare assistants. So if you remember the 7 pillars of care that I spoke about a couple of days ago, the treatment that we provide will fall within those pillars. So some things we'll be doing will be about promoting people's mental health. So that might be things like, you know, prescribing medication, or all the things that Evie has said today about being observant. So you might come up to me and say, Sade, I noticed that Jack didn't sleep all night. And that might be an indication that his mental health is not so good. Then we have the aspect of physical health, isn't it? So maybe, for example, Sade's overweight and has diabetes, and she needs some interventions from the nurses and the healthcare assistants and maybe the occupational therapist to address issues around her eating and around her weight. And maybe part of the program is that Sade, although remember we won't have any females there, but let me think Jack. So part of the program might be that Jack needs to focus on healthy eating. So we have a dietitian come in and try and work with him and the nurses around healthy eating. And then part of the treatment prescribed might be that Jack needs to go to the gym 3 times a week. Am I giving a picture? And then somebody, I think it was Kaya, that asked about learning. So maybe now Jack is getting to a point where his mental state is much better, his symptoms are not so bad, and now Jack doesn't know how to read and write properly. But Jack is hoping to get back into the community. And Anya might prescribe that actually he needs to have some lessons to learn reading and writing. So maybe Jack 4 times a week has somebody come in who's teaching him on reading and writing. Yeah? And then we think about relationships. So maybe Jack has had really difficult relationships, and so there needs to be some work around relationships. So maybe he's going to be meeting with Dr. Capri once a week, where he's doing therapy, trying to understand what the problems are with relationships. Or it might be that Dr. Capri thinks, really, we need to do some family work, where certain members of the family come in, maybe every fortnight, and they do some work together around building their relationships. Can you see how it will? So this is sort of different from a social care model because we're a hospital, and our role, all of us together, is to treat. And Maggie's team is really important because as Evie's been talking about environment, I've worked in some places where the food has been absolutely shocking, actually. But at the end of the day, am I really going to want to engage with Dr. Capri or engage with you if for the last week I didn't have a good meal? In fact, when I've attended lots of patient meetings, the number one thing people have often complained about is how horrible the food is. So there was a lot of thought brought in bringing Maggie in as an expert and her team to make sure that the patients have good food. But actually, if for whatever reason we're on site and we are having food, needing to eat with the patient, that the food is nice for us. So can you see how Maggie's team is really important in making sure that the patients are okay and can engage in their treatment. But why it's important, for example, that the housekeepers are trained like this, so that if they see something going wrong, they can come and whisper to Evie or to Alan and say, I saw this or I saw that. So it is very different, and we know that, and that's why we've put aside 3 weeks of different things to give you the basis. Literally speaking, some of it we're not going to be able to convey so well until you get on site, and then it will all begin to make sense. Yeah?
Yeah, and as we said, this is such a big relational security is something that you're going to build on for the rest of your careers. And I'm sure, when I did relational security when I was like a medical student, and that was like, I'm going to be a forensic psychologist now, because it was just something that I thought is amazing, and I really wanted to engage with it, and I wanted that to be part of my future career. So I'm hoping I'm giving you all the same kind of warm and fuzzy feeling. But anyway, right. So we're moving on to the final quadrant, which shouldn't be a picture of a visitor's badge, but there we go. So it's the final quadrant, and here we're talking about like the outside world. So we're talking about the outside world coming in, aka visitors, and we're talking about our patients going out into the outside world. So that is like telephone calls, social media, and leave and stuff like that. Okay. So first of all, we're going to think about visitors. And when we're thinking about visitors, what do we need to do? We need to ensure that we know what the potential risks to the patient and to the visitors are. Like we've already mentioned that a lot of patients, like they're victims of family members. Okay, it's often the fact that they've beaten their mum up really badly, which is what is brought them into hospital. So we have to